Hello everyone, I'm going to assess one of my students' role play conversations and provide the word-by-word feedback along with the feedback against each parameter and then the overall score. Let's start the assessment now. So this is the role play card and I'm going to play the audio file now. Let's start the assessment.
My name is Feba Abraham. I'm a registered nurse who is working in this accident and emergency department. What brings you here today?
See, nurse, actually what happened, I'm a model basically. So I was doing my hair dress with, like straightening and curling like this. So that time unfortunately, my forehead got burned, I'm so much worried about that.
Oh, I can certainly understand, ma'am, that you are a model. But before moving further, I would like to know your name and age for my documentation purpose.
I am Rakia, 23 years old.
Thank you, Rasia, for your information. And I'm really sorry to know that you have burned your forehead. But don't worry, we have all proper solution to deal with.
So all proper solution, okay, solution, all proper solution. So it's not solution, but it should be solutions because all is going to be an indicator of a plural noun in this case. Okay, that's one mistake.
Is that okay for you?
I'm looking for that only because the practical difficulties of my career, because it is very important. This physical appearance is very, very important in the name of my beautician.
Yes, I can.
Can you understand what I?
Yes, certainly I can understand that. Being a model, it is very difficult, to face many publics, and this condition has led you.
Not many public, but just public. Otherwise, many people. To face many public. Otherwise, you could have mentioned public members or something, So this is wrong. So you should say face many people or public, just public, okay?
But don't worry. I will be providing with proper painkillers and analgesics and provide you with some ointment to prevent further damage to that area. How's that sound, Razia?
So how's that sound? It's how does that sound? It's not how's that sound. You should say how does that sound, okay? All right. Let's go to the next one.
I'm having this pain like burning, could you please understand my pain?
Oh, I can really sense that you are going through a severe pain. Can you rate your pain on a numerical scale where 0 is no pain and 10 is severe pain?
Great way of asking the information. So that's good. I'm very happy with that. You are able to get the required information in an effective manner. So good. I'm very happy with that.
7, 8 like this.
Oh, that means you are in severe pain. Yes, I will be providing you with the injection. It will subside your pain, and also I will be explaining you how you can take care at home when you go back home and apply some sunscreen and aloe vera gel. These are the things. If you apply it, those areas will be fine once you do that.
And these things will help to heal this scar because, as I already told you, this scar I don't want because I'm a model. I don't want to be ugly showing my scar and all. Can you understand?
Yes, I can really understand that you are a model. If I were you, I would have also reacted in the same manner. Well, let me arrange a dermatologist to you.
Okay, dermatology and then dermatologist to you. Okay, so dermatologist to you. Okay, so dermatology could have been rectified, could have been removed but it's not that bad. It's okay. At least you are able to identify the mistakes and correct it. But still, you could have prevented that, from occurring even.
And he or she will help you to face this condition. She will be providing you with proper treatment. Is that okay for you?
Okay, but have you dealt with this type of patients? Because I want to know how long it takes to heal. Have you ever seen like this patient?
Yes, that is a relevant question you have asked. Yes, we have been dealing with 10,000 cases like this, and we have also seen a drastic change in other patients' condition. So you don't.
To some extent, background noises and background noises were committed. For example, she said, 10,000, and then she has committed some background noises. So you have committed some background noises, but it's not that bad. Actually, it's not stopping me from understanding your information, but still, I just wanted to note this one down. These things could have been avoided, okay?
Worry, it will take usually 3 to 6 weeks to get healed, and as I mentioned you earlier that a dermatologist appointment will be there, and he will be providing you with proper treatment. Is that okay for you?
So, how long I have to wait for this to disappear this form? That is my main concern.
Yes, as I said, it will take 3 to 4 weeks to recover from that heal, and as the dermatologist will be providing you with a lot of cosmetic treatments which are available. Once they will provide these treatment, you will be able to recover sooner. Is that okay for you?
Okay.
And
That means I have to come again for
yeah,
my
cases.
the
You have
dermatologist.
to come back within 2 weeks for a review. Is that okay,
Okay,
Razia?
yes, that will be helpful.
Okay, and as I have mentioned earlier that when you go back home, continue to take all the medication as well.
Continue continue to take. You could have used any of them. You don't need to say both, because both of them are correct. So we don't need to mention them. Continue taking all, and then you said continue to take all. Both of them are same. So use either, please, and not together, not both. Okay.
As take plenty of water, get hydrate yourself, and take a balanced diet. Is that okay?
Yes, thank you so much.
I hope I have cleared all your doubt. If you have any question, you can just ask me. Thank you so much.
Yes, thank you. Then,
Yeah.
Okay, that's an excellent role play conversation. I'm very happy with the way that you have overcome all your grammatical mistakes this time. I mean, you have committed only a few mistakes, okay, only a very few grammatical mistakes, but background noises could have been avoided because you have dragged, some of the words. But apart from that, it was absolutely fine. Okay, I'm very happy. So you were able to show care towards the patient. You were able to use the vocabulary effectively and appropriately. You are able to share the information well in majority of the role play conversations. However, you could have used some connecting phrases. So that is actually missing. You could have used, but you didn't do that. You could have used at least some of them. Okay. I think more than 70% of the conversation was okay, but the remaining 30% wasn't that good as far as the connectivity is concerned. You were able to address the patient's concerns. I'm very happy with the way that you have done. Well done. That's good. Your pronunciation could have been a little bit better, because you have committed a couple of background noises, but it's okay for majority part of the role play conversation. I'm happy with that, so it's good. You were able to confirm the information with the patient and made her to follow the recommendations as well and the appointments and so on. So that's good. All right, so you have committed very less mistakes in this one. So I'm very happy to give you at least 370 for this role play conversation. You should be able to get at least 370 for this role play conversation. I'm 100% happy, and you will definitely be able to get at least 350 in your examination that is going to happen the day after tomorrow. So mark my words, if you can perform the same way, okay, without any hesitations, without any passes, or if you don't commit any silly mistakes on the test day, so don't get nervous, okay, during the examination. If you don't do anything, different from this role play conversation, you should be able to get at least 350. Okay, well done. Congratulations.